My name is AJ Green, and today I will be covering the topic of a recent article I've found, which is Scientific Development in Detecting Sepsis Early in Newborns. But before we dive deeper into the story, there are just a few things that we need to know. So the first thing we need to know is, what is sepsis? Sepsis is the irregular response of the whole body's immune system to an infection or an injury. Usually can be fatal if left untreated. It can also cause our organs to go into failure because of the lack of oxygen and even death. Almost every year, over 47 to 50 million people are affected, with a mortality rate, meaning death rate, of 15 to 50%. The most vulnerable and commonly affected are those elders over 60 years old and infants, along with people that have had previous health conditions. If you look to the right of this slide, here's an example listing common symptoms of sepsis. We have having a fever, shivering or feeling very cold, feeling extreme pain or general discomfort, having pale or discolored skin, feeling sleepy or confused, feeling so ill that you feel like you might die, and shortness of breath. Sepsis is usually diagnosed through running tests for your blood, urine, and imaging, as shown by the image on the right. Neonatal sepsis is even more dangerous because it affects their underdeveloped immune system, making them more vulnerable. The effects of neonatal sepsis can also be damaging because it can delay cognitive growth and affect normal development of a child's motor skills, as well as cause other long-term health problems as they grow older. This illness is shown to be more common in lower through middle income families. A group of scientists recently conducted a study following their hypothesis, which was, is there a way to predict neonatal sepsis before symptoms even start showing? For this study, they took 497 infants, 403 of them which were confirmed to have neonatal sepsis, and 94 of them who represented the control group. They then collected data from 3 different categories, which were listed as perinatal factors, clinical signs, and markers of infection. To get a better understanding, we need to know what each of these different categories mean. The perinatal factors consisted of things like the baby's weight, gender, the type of childbirth delivery, the gestational stage, and the maternal risk factors. For the clinical signs portion, they took information like the body's temperature of the baby, if the baby had jaundice, lethargy, loss of appetite, if the baby had irregular heartbeat while resting, and if the baby had abnormal breathing. And for the markers of infection portion, they took the CBC, which is the complete blood count, a measure of inflammation, and signs of bacterial infection. After collecting all of this data, they then took the infants and placed them under 3 groups, which were proven to be with neonatal sepsis, probable with neonatal sepsis, and suspected to have neonatal sepsis. And on this slide, we just have a picture of a graph listing the different factors and the importance of them in determining the chances of having neonatal sepsis. And here it seems that the measured inflammation, or the CRP concentration, provides the highest value in helping determine if a baby or an infant will be septic. The goal of this study was to find which factors corresponded to the chances of an infant being septic. The scientists then took all the information they had received from the study and used the machine to find the result. The study resulted in finding that the infants placed under proven and probable did have sepsis, while the ones placed under suspected and the control group were said to be non-septic, which means that the higher the percentages are in the data they had collected, the higher the chance is that the infant will be septic. With any study or experiment that is conducted comes the limitations of the test. For this particular study, there were 2 that I was able to find, and these were that the clinical signs that were recorded had turned out to not be reliable because it could have also passed as other common illnesses like pneumonia or meningitis, and that also the blood could have been contaminated, which would have led to false results. Now we ask, how does this information help us? Well, this development in the science field will benefit us because it can help to dial down the amount of fatalities in the year due to the effect of sepsis, specifically neonatal sepsis. We would be able to detect sepsis early on in the most vulnerable victims, which would be infants. So, in conclusion, the discovery of a tool to detect neonatal sepsis in seemingly healthy newborns is a major advancement in providing a better world for children and hopefully for the rest of the world as well. It was stated that it is hopeful to develop a tool to detect sepsis in its early stages for the rest of the population as well, like the adults and the elderly. Science remains to be an important factor in developing a safer and healthier world. Thank you.